One.
Hi, I'm just giving some privacy here. I'm Liv Lindquist, and I'm going to be your student nurse today. And I'm going to teach you about some diabetic foot care because you were just recently diagnosed with type 2 diabetes. Are you comfortable where you're at right now?
Mm-hmm.
Okay, is anything bothering you?
No.
Okay, good. Well, first we're just going to be talking about you have diabetes. So you have high blood sugar.
What does that mean?
High blood sugar?
Mm-hmm.
So basically, your body retains a lot of sugar and it doesn't have the insulin, which is a hormone that your pancreas spits out, which is an organ that you have, to decrease that. And so your body doesn't generate that, or it doesn't generate enough of it. So you just have a lot of that sugar retained in your blood. Does that make sense?
Mm-hmm.
Okay. So we have a little handout for you. And it just is going to show you like what is wrong. So like I kind of explained what diabetes was, and over time how this can hurt your nerves, especially in your extremities, like your arms and your fingers and your legs and your feet and your toes.
Okay.
Does that make sense?
Mm-hmm.
And then so like when it hurts your nerves, you can read that by the way. When it hurts your nerves more distally, so which farther away from your body, it's you can feel like a kind of numbness from that, and which is basically like this tingling feeling. Have you ever hit your elbow and like you felt like your fingers kind of have that feeling?
Yes.
So that's kind of like what you're gonna be feeling in those toes, and like from that. So with doing that, you could step on things and not really feel it. You could stub your toe and not feel it, and that can cause a lot of other issues, because since you have such high like sugar in your blood, you don't heal as fast.
Oh, okay.
And so it's just like very delayed, and so it takes longer amount of time. So if you step on something and you don't realize it, that's already a problem. And then if you don't realize that you did it, that's a bigger problem, because then you can't fix it and you can't try to get that better faster. Does that make sense?
Mm-hmm.
So I'm just going to teach you how to like look for these signs for you. So we're going to use these feet right here in the bed with our toes and our feet. And so some of the things that you can look for is if you are ever like just in bed at night and you want to check, you can use like a mirror and you can see it, because it's kind of hard to like put your foot up and look. So you can use a mirror and kind of put your foot, spread your toes and look in between. You can also feel it with your hand like this. Can you do that for me?
Yeah.
Very nice. And just kind of like feel if there's any different like cuts or scrapes, or if anything like hurts more, like as a bruise. And so you can use that. You can also do your hands. Also, if you ever like suspect that you hurt something, you can always just take off your feet and try to inspect like the sides of your feet and things like that. So that's where it says on this, using a mirror, it kind of explains that for you. And you're looking for any like red spots, like from your shoes or anything, and like you're feeling for changes. And we also want you to protect your feet. So like wearing shoes at times, wearing socks, just always wear something clean, so there's less signs of like an infection, which is basically just like something going into your foot and making you have a reaction.
Okay.
And this is important because like we don't want you to have a complication, so something that goes wrong, you can keep that. Can you teach me how you're supposed to be doing this?
So if I'm in bed or at night, or just anytime sitting down and have a mirror, I can put it down here and look for anything that looks like a scrape or a cut or an infection, and feel around and make sure that I look between my toes.
Yes.
And everything, because sometimes I won't be able to feel it. Yeah. And I don't want an infection, because if it does get infected, then my diabetes is going to make it take longer to heal.
Yeah, that's great. That's wonderful. And does anything like seem like it's not connecting or anything like that?
No.
Okay,
I think
good.
I got it.
In this video, I have used a teach back method with my patient where I explained things to her and then I asked her to repeat that back to me. I would also change things if I had a patient with a visual disability by using Braille or by using an interactive where they could feel it. If family members were also in the room, I would also explain this to them so they could also reinterpret it and reiterate it at home. If I had an older generation, I would use even bigger, probably explanations, even though it is big, and I would change it on that. If I had a younger generation, I would use an interactive model so they would be interacting with what I was teaching. If I had a cultural environment or a cultural population, I would use an interpreter or use something culturally appropriate to them and how they're supposed to be doing that based on what they needed. Yes.